Figuring out the healthiest foods to feed your baby or toddler can be daunting and confusing. We spoke with a pediatric dietitian about how parents can overcome some mealtime hurdles in today's Health Matters. Feeding children can be a roller coaster ride. Sometimes they love what you serve. Other times they want nothing to do with it. So making sure they eat healthy, nutritious meals can be a bumpy ride. Virginia Kosicki, a pediatric dietitian with UT Physicians, says starting off on the right foot is key.
Historically, a lot of parents have started with infant rice cereal because it's fortified with iron, which is important for growing babies, but that doesn't necessarily have to be the first food.
Because rice can have high levels of naturally occurring inorganic arsenic, Kosicki says parents can alternatively give babies oatmeal cereal and, of course, pureed fruits and vegetables. Possible food allergens to peanuts, eggs, milk, and shellfish, among other foods, are also a concern for parents. But Kosicki says new data shows it's actually best to expose babies to small amounts of common food allergens early on.
There was a time a few years back where the recommendation changed to, hey, maybe we should wait until they're older to introduce some of these top allergen foods, but now they've gone back to say you can start introducing the top allergen foods once you start solids, so around 6 months.
Another concern, organic versus non-organic foods. While organic foods can have less chemicals, research doesn't suggest they provide major nutritional benefits.
Organic is kind of more of a personal choice. When it comes to the heavy metals in foods, they found that there was still heavy metals in the organic baby foods. So you're not necessarily going to have lower metal content in organic versus non-organic foods.
Kosicki says ultimately parents should be patient.
Even though you say, oh, they won't eat that, maybe don't decide that for them. Just keep offering it and offer it with the food that you know that they like, so that they just have it as an option there, and hopefully over time they will become more comfortable with eating that food.
For more on our series with UT Physicians, go to khou.com/healthmatters.